Hello everybody, this is Gary. Today is April 13th, 2022, Wednesday. It is 12:52 p.m. Eastern Standard Time in the United States. And this is my coping with schizophrenia blog entry for today. Today is the 13th of April, and on the 29th of April I am still scheduled for knee surgery to remove part of a torn meniscus. The meniscus is part of the knee that's kind of like cartilage. It cushions the knee from shock when you're walking or running. It's sort of like a shock absorber, and it can become damaged and teared, and my meniscus is partially teared, not all of it. They're going to remove part of the meniscus on the 29th. That's part of my surgery. They're going to remove any loose cartilage and repair part of the meniscus that they think they should be able to repair. But most of it's going to be removed with any extra loose floating cartilage. Right now my right knee is in a lot of pain. I went outside today. I had to walk to the bus station to take the bus to the pharmacy to pick up a prescription for Klonopin, which I use for anxiety. My knee was in a lot of pain just doing the walking, and I wasn't actually walking that far. I was just walking across the street to the bus station, and then from the bus to the pharmacy, and then from the pharmacy back to the bus station, and then back to my apartment. So I didn't walk that far. It wasn't a strenuous walk. I don't need to walk upstairs because I have an elevator in my apartment building, and my knee is still in quite a bit of pain. So I'm still planning to go ahead with the surgery. I was given the option to try a steroid injection directly into my knee before we try surgery, but I decided to go ahead with the surgery just because it seems like a more permanent solution to a problem that is mechanical in my knee and that needs to be mechanically corrected with surgery. So I'm still nervous about surgery. I've already had 2 surgeries in the past 12 months on my bladder and partially removing my prostate. I don't enjoy surgery. I don't enjoy taking painkillers that they prescribe, but often the painkillers are necessary because pain after surgery can be intense. I'm not on any opioid painkillers right now. I suppose they will probably prescribe 4 or 5 days worth of painkillers after surgery, but nothing beyond that. Obviously, getting addicted to pain medications is not something I want to do. The only thing I do for pain right now in my right knee is a lot of ice on my knee every few hours. Trying to do physical therapy, which I'm still doing. Just generally keeping my leg elevated, and just taking it easy as much as possible. I still exercise on my exercise bike. I am overweight, and I think exercise is important, and I'm still doing my physical therapy exercises. I'm also taking a Aleve for pain, which is also known as naproxen. I also take Tylenol for pain. I take Cymbalta for pain, which is an antidepressant that's for pain throughout my body, unrelated to my knee injury. I take Flexeril for muscle and back pain. And I take Neurontin for nerve pain and body pain. As far as my schizophrenia is concerned, I haven't made a video in a few days. I've been kind of paranoid, confused, not doing well over the past few days. I'm feeling better today than I was over the weekend or last week. My paranoia is not that bad today. My auditory hallucinations are at a bare minimum. My depression's not that severe. My anxiety levels are not that severe today. So there's not much to report in my actual psychiatric symptoms. I do have a lot of medical appointments coming up. They've been frequent over the past month and a half. Next week I have a psychotherapy appointment. I have an appointment with a back specialist about my spine, which has arthritis in it. We're not planning to do surgery on my spine. We're just doing physical therapy on my spine. One of my discs at the base of my spine is very, very worn, thin, almost non-existent. But there's not a lot of pain there, and so surgery is unnecessary. Next week I also have a psychotherapy appointment and an appointment with my psychiatrist and a dental appointment. So I have a lot of appointments coming up related to different things: psychotherapy, psychiatry, orthopedics, dental. There's just a lot going on, and I'm kind of feeling a little overwhelmed. But I just try to take it day by day. I'm going to try to get back to my daily schedule, which I haven't been doing for the past 4 or 5 days. Keeping a routine is important. And I've been sleeping okay. My insomnia isn't all that bad. My sleeping seems to have improved a great deal when I started the antidepressant Cymbalta. I take Cymbalta early in the morning because it can be stimulating, and I didn't want to cause insomnia. But I think overall the Cymbalta reduces my anxiety, depression, as well as physical pain, and I'm sleeping better because of the Cymbalta. Insomnia has not really been a problem, and that's important because the less sleep I get, the worse my paranoia gets, the worse my hallucinations get, the worse my depression and anxiety gets, and then my insomnia gets worse, and then it just goes around in circles. But that really hasn't been much of a problem. Other than that, there's not much going on. I'm still planning to do the surgery on April 29th.